Member for Richmond North Centre.
Thank you, Mr. Speaker. For the past 7 years, we have witnessed a troubling deterioration in public safety across British Columbia. Many families do not feel safe walking down the street due to random violent attacks from repeat offenders, but we didn't get there just overnight. For 5 years, the former Attorney General, now Premier, implemented his soft on crime policy that have seen a 37% increase in violent crimes, while overall crime has surged by nearly 10%. This situation is the direct consequence of the Premier's failed catch-and-release justice system, which has repeatedly failed to keep violent criminals from re-offending. Additionally, we have seen an alarming 11% rise in youth crime rates over just last year. Under this government, not only are our youth more exposed to addiction thanks to drug diversion under this government's watch, but also crime. These issues have not only persisted but have worsened significantly. The Premier has had 7 years to address these problems, yet the situation continues to deteriorate. One of the most glaring examples of the Premier's failure to provide safety is reckless decriminalization experiment. For over 15 months, this policy has allowed open drug use to spread chaos throughout BC communities, with the government providing little or zero support for those affected. In my community of Richmond, we have seen firsthand how this government will ignore concerns and then backtrack. When the proposal for a safe consumption site in the hospital was put forward, the community's strong opposition was initially disregarded by this government. In fact, on the day when Richmond City Council discussed the proposed safe consumption site, BC Minister of Health expressed his support for the injection site despite the Premier stating the following day that it did not appear to be immediately needed in Richmond. It wasn't until the government was faced with a petition of more than 22,000 signatures that they began to pay attention. Throughout all of this, I was the only MLA from Richmond present at the City Council meeting, actively listened to and addressing the concern of our community members. Where were the Richmond MLA from that side of the House? Honourable Speaker, through you to my government colleagues from Richmond, your community needed you, and you abandoned them. The announcement on May 7 that BC will be rolling back public drug use further highlights their failures. Nowhere did they accept accountability for the chaos that they have caused, nor have they planned to increase services. Our BC United Caucus is prepared to tackle these challenges. Through our Better is Possible plan, we will build a truly recovery-oriented system of care that prioritizes free treatment over free drugs. We will do this by eliminating user fees at publicly funded addiction treatment beds and providing direct government funding for private beds so that we can ensure no one faces financial barriers. Our commitment to build at least 5 regional recovery communities will offer comprehensive addiction treatment programs where individuals can reside for up to a year, receiving continued support. We will significantly enhance our efforts in prevention and awareness, particularly among youth, so that they are educated on the dangers associated with drug use. While Better is Possible, ensure people have the services they need to get better. Our Safe BC plan will restore safety and security at every community. We will scrap the reckless decriminalization pilot that has led to skyrocketing public drug use. The BC United Caucus will treat all crimes seriously, even minor ones like shoplifting, bike theft and vandalism, and expand community service as a required option for sentencing for minor offenses. Not every offense requires jail time, but all crimes will have consequences for those facing sentences. We propose an innovative approach, offering individuals a choice between traditional incarceration and secure treatment options. This initiative will integrate mental health and addiction services within BC correctional institutions, aiming to treat underlying issues and prevent future offenses. We need big ideas and bold leadership to help get BC back on track, and the leader of the official opposition sadly that, unlike the NDP government's record, after 7 years and no result, it's time to restore accountability in BC justice system and provide compassionate, comprehensive care for those who need it. United will fix it. Thank you, Mr. Speaker.
Thank you, Member.